Have you ever heard a cough so intense that it leaves you gasping for breath, followed by a sharp whoop? Pertussis, or whooping cough, is more than just a nuisance. It's a highly contagious respiratory infection that demands our attention. Stay with me as we uncover the science behind this condition, its symptoms, treatments, and most importantly, how we can prevent it to protect our loved ones. Let's get started. Pertussis, or whooping cough, is a severe respiratory tract infection caused by the bacterium Bordetella pertussis. It's marked by a hacking cough followed by the distinctive whoop sound as patients struggle to catch their breath. While it can affect anyone, infants and young children are at the greatest risk of severe complications. Now let's dive deeper into what makes this disease so dangerous. The mastermind behind pertussis is Bordetella pertussis, a bacterium that primarily attacks the respiratory system. But how does it spread and cause such intense symptoms? Let's find out. The primary route of transmission is through aerosol droplets from an infected person. When they cough or sneeze, tiny infectious particles are released into the air, ready to be inhaled by the next unsuspecting host. Once inside the body, Bordetella pertussis embarks on a calculated invasion. Entry and attachment. Inhaled as aerosol droplets, the bacterium attaches to the ciliated epithelium in the respiratory tract. It then releases toxins that disrupt normal cell functions. Damage and immune system. Evasion. Toxins like TCT and LPS damage the cilia, causing mucus buildup and triggering relentless coughing. Pertussis toxin manipulates immune cells. Macrophages. Their antibacterial functions are suppressed. Neutrophils. Toxins block infiltration and phagocytosis. Dendritic cells. Their maturation and signaling are disrupted, weakening the immune response. Tregs. IL-10 secretion is enhanced, suppressing Th1 responses and allowing the bacteria to thrive. This interplay between the bacterium and the immune system is what makes pertussis a prolonged and challenging disease. The symptoms of pertussis typically unfold over a 6-week course and are divided into 3 distinct phases. Catarrhal phase, 1 to 2 weeks. Early symptoms include nasal congestion, rhinorrhea, sneezing, and a low-grade fever. This phase is the most infectious, as the bacteria multiply and spread. Paroxysmal phase, 2 to 4 weeks. Intense coughing fits, or paroxysms, dominate this phase. Each fit can last several minutes and is followed by the characteristic whoop sound. Patients may experience severe exhaustion after these coughing episodes. Convalescent phase, weeks to months. The coughing gradually subsides but may persist for weeks, leaving the patient fatigued and recovering slowly. Diagnosing pertussis requires careful evaluation. A physician typically begins with a clinical examination, but for confirmation, these methods are used. Culture tests. A sample is taken from the deep nasopharynx to grow and identify the bacteria. PCR, polymerase chain reaction. A highly sensitive method that detects the genetic material of Bordetella pertussis. Treatment for pertussis focuses on managing symptoms and reducing the spread of infection. Here's what it involves. Supportive care, keeping the patient hydrated and ensuring proper oxygen levels. Antibiotics. Azithromycin is recommended for children under 1 year. Erythromycin or clarithromycin for patients older than a year. The earlier the treatment begins, the better the outcome. However, prevention remains the best defense. Prevention is our strongest weapon against pertussis. Here's how we can stop it in its tracks. Vaccination. The DPT vaccine is administered to infants at 6, 10, and 12 weeks of life, providing essential protection. Adults and caregivers should ensure their booster shots are up to date to prevent outbreaks. Hygiene practices, using face masks and maintaining proper hand hygiene can significantly reduce the risk of transmission. Pertussis is a formidable opponent, but with knowledge, timely intervention, and preventive care, we can turn the tide. Protect your loved ones by staying informed and up to date on vaccinations. Together, we can ensure a healthier, safer future. If you found this video insightful, don't forget to hit the like button, share it with your community, and subscribe to our channel for more health tips. Until next time, stay safe and take care.